Health Minister Dr. Aaron Motsoaledi has highlighted shortcomings in Section 59 of the Medical Schemes Act. This after a panel report found evidence of racial discrimination and unfair treatment of black healthcare professionals by medical aid schemes, Discovery, GEMS and Medscheme. The report made 4 recommendations, including that schemes establish an early warning system to notify practitioners when they are being investigated. Briefing the Portfolio Committee on Health, Motsoaledi says they will seek legal advice on the matter, but also urged members not to be bystanders.
Now, I want to ask honorable members to realize that you are not also bystanders and observers in this matter as members of parliament, as members of the Portfolio Committee. You are also active participants because you have passed the act in parliament. I'm not trying to put the blame, but this is a statutory matter. You have passed the act in parliament. You have a right to call everybody and ask them a question and make recommendations. On our side, honorable members, because of this silence in the act, we thought we will need to look for legal advice, because this will be a legal matter, obviously. Legal advice of what can be done and what cannot be done. Because Advocate Ngwetobi emphasized that they were not a court of law. They were not putting anybody in a court such that at the end they say you are guilty, you are fined this much. They were just inquisitorial to find out, is it true when the black service providers say they are discriminated upon. So we still due to look for that legal advice about what and what cannot be done.
Discovery Health CEO Dr. Whelan joins us live now for reaction to that. A very good evening to you, Dr. Whelan. Now, Section 59 panel's final report paints a really bleak picture of racial discrimination by medical schemes, including yours as Discovery Health. In particular, with yours stating that black psychiatrists under Discovery were about 3.5 times more likely to be investigated and found guilty of fraud. You've disagreed with these findings. Tell us why.
Well, firstly, thank you for hosting us. It's a very important topic, and I'm glad we've got the opportunity to discuss and debate this. I think I wanted to start out by saying that as Discovery Health and Discovery Group more broadly, we have a zero tolerance approach to any form of discrimination, whether it's race, religion, gender-based discrimination. So it's important that we start there as a founding principle and value. I think secondly, it's important for your viewers to understand that medical scheme claims are paid on a good faith basis. So providers submit claims to medical schemes. Those claims are paid so long as the membership number is accurate, so long as the provider number is accurate, and so long as the claim is within the frame of the benefits available. So it's a good faith system. Related to that, it's also important to note that most providers are entirely ethical and professional. In fact, we only see about 7% of providers investigated on an annual basis. So it's a relatively small amount. And in those investigations, only a very small proportion end up with significant sanction where there have been severe infractions. Many of the investigations are resolved on the back of simple errors that have been made in the claim submissions. Where those errors are made, we resolve those amicably with providers and we move on. Of course, if there have been more severe errors, errors you're pointing to, fraud and malevolent abuse across the system, we need to deal with those. You've got to remember that, because we pay the claims in good faith, if there are erroneous claims submitted into the system, we need to be recovering those funds. In fact, if it were not for the recovery of these funds, medical scheme contributions across South Africa would be somewhere around 11% higher. And we already know that medical scheme contributions are significant. Imagine having to pay 11% more on your medical scheme contributions. In relation to the allegations, I think it's important that you understand the processes we undertake in paying these claims. And the first point I wanted to make is that we pay claims on a purely anonymized basis. As I mentioned earlier on, it's based on member number and provider number. There is no race tag whatsoever in our systems. We cannot identify the race of the provider in our claims process, and it's purposely designed that way. The second point I wanted to make, and it's very important for your viewers to understand this, is that 78%, almost 80% of our investigations relate to member tip-offs, where a member looks at their claim statement and says, hang on, I didn't get that service, or I didn't see that provider, or I didn't get that particular medicine. And they write to us and they call to us and they say, there's something wrong with my claim. You need to investigate this. So for the report to say, we're racially biased, makes an inference that member tip-offs are racially biased. And I think we know that that is patently impossible. There's no bias across a member population. A member population is just seeking to pay for services rendered. And if you imagine there's been an erroneous claim against your medical savings account, you certainly would want that money back in your medical savings account. So that's the second point I wanted to make is 78% of claims of investigations are as a result of member tip-offs. The remaining 22% of claims that of investigations relate to analysis we do across the claims database. And we've got an algorithm that runs across the database that looks at different patterns of claims. That algorithm is based on 30 risk factors. We shared all 30 risk factors with the Section 59 panel. They went through all 30 risk factors in the algorithm. They were comfortable that all 30 risk factors were entirely objective with no racial connotation. And if one thinks about that, there's no way to combine those 30 risk factors to create your bias across the risk factors. So it's important for your viewers to understand that we process claims on an anonymized basis on the member number and provider number, 78% based on tip-offs, an algorithm that runs entirely an anonymized. I did want to one more point here, just before I finish up here, and you can ask here some more questions. The other point I wanted to make is that while the Section 59 panel relied on the evidence of a single statistical witness, we employed independent experts out of the London School of Economics, Deloitte. In fact, one of our expert witnesses was the previous Statistician General of South Africa. So we've taken broad input and advice not only on our methodology, but also on the analytics that's been conducted by the panel. And all of that came out entirely above board, in alignment with our values and principles across Discovery Health and Discovery Group.
And Dr. Whelan, I hear you speaking about, 78% of these complaints coming from member tip-offs as well, also explaining how the algorithm works. But going back to what sparked this investigation was sparked by complaints by Black medical professionals. Why do you think that there would have been these kinds of complaints based off their lived professional experience? Is it just happenstance that it was them in particular who seemed to be targeted for these investigations?
Yeah, it's a very good question, an important question. This is obviously a very sensitive topic and sensitive area. The investigation started way back in 2019. It was initially a complaint against the government employees medical scheme called GEMS. This is a medical scheme for 2.2 million medical schemes, 2.2 million members across the government. It then extended into PolMed, which is the police workers medical scheme. When the Council for Medical Schemes decided then to do an investigation, they extended the investigation to include the two big administrators across South Africa, including Medscheme and Discovery Health. Medscheme administers, amongst others, the Government Employees Medical Scheme, PolMed, Bonitas, Fed Health, and so on and so forth. And Discovery Health administers the Discovery Health Medical Scheme together with 17 other medical schemes. So it's a broad investigation. It was instigated by two small provider groups, and we early in the process engaged those provider groups around the issues that were raised. As I said to you before, this topic of fraud, waste, and abuse, beyond being sensitive, has a very broad range of parameters. On the one side, there are simple errors that get made in claims. On the other side, there is patent fraud. So it's a sensitive terrain. It's a complex terrain. There's lots of emotion raised in this. We see the similar emotion across the different race groups. It's never a comfortable thing to be saying, look, you've submitted an erroneous claim. That's regardless of race across the system.
The health minister, Dr. Aaron Motsoaledi, basically has taken this final report, because it is the final report, as confirmation of this racial bias as well. Would you say that not only did the Section 59 not agree with you, but also the health minister is also not agreeing with you? And the criticism has been that the schemes had 4 years to respond to the panel's preliminary findings. And according to the minister, the schemes failed to adequately justify the practices that you're speaking of. What's your response to that, Dr. Whelan?
Yeah, so there's a few important points there. I think the minister rightly points out this is a non-legally binding report. It was an investigation. It's a non-legally binding recommendation. No formal legal process involved in this. The report is also very clear around it being non-legally binding. It's also very clear that the judgment is on the basis of probability. So it's not a conclusive finding. It's on the basis of your probabilities. So it implies you've got to think about the statistical judgments across the report. So that, and we'll certainly consider our legal options in terms of responding to this report. At the heart of the matter is the underlying analytical methodology applied in the investigation, and that's what we're disputing here. I can tell you referred to the risk ratios a little bit earlier on. The allegation that the probability of a black practitioner being investigated over a white practitioner of 3 to 1, particularly in relation to psychiatrists. The report opportunistically reports on all of the risk ratios that were greater than 1, but neglects the risk ratios that were less than 1. When you think about your risk ratios, anything greater than 1 would suggest a propensity that a black practitioner or had a greater propensity to be investigated. But a less than risk ratio means that there's a lesser propensity. And I can tell you that 40% of the risk ratios were less than 1. So how do you deal with a risk ratio of, say, 0.5, where a black practitioner is half as likely to be investigated over a non-black practitioner? How do you deal with a risk ratio of 0.1, where a black practitioner is 1/10 less likely to be investigated than a non-black practitioner? So I think you've got to think carefully around the statistical and mathematical analysis that sits below the findings in the investigation, and that's what we're disputing. It's also important to point out, in terms of the analysis conducted by the expert in the Section 59 report, it relied on converting surnames and first names into race profile. So you remember that I said earlier on, we work entirely on provider numbers, member numbers, and then we've obviously a provider number could link to a surname, and what the Section 59 expert did was converted surnames and first names into a race profile, and this is notoriously inaccurate. In fact, we found in the initial phase of the investigation, the expert analysis suggested that 50% of the practitioners in Mitchell's Plain were white, and I think that is highly inconceivable. That just demonstrates the challenges with converting names and surnames into race differentiation. So I think what we're saying definitively as Discovery Health and the Discovery Group is that there are some significant concerns around the statistical analysis conducted by the single expert in the Section 59 investigation and then presented to the panel as inconclusive facts. And when you look at the statistical analysis, there is a wide margin for error. And on such a sensitive topic, you can't afford to be wrong at all around the statistical analysis. Calling for is a review of the analytics and the statistical analysis, and therefore the inference over the top of that.
Unfortunately, we've run out of time, Dr. Whelan. Thank you so much for making time for us this evening.